As part of their dedication to community awareness and recognition, Florida Hospital Waterman recently held a luncheon to honor those touched by ovarian cancer. We spoke with the specialist at Florida Hospital Waterman's Cancer Institute about women's cancers and why it is so important to educate the public.
What we're trying to do is to educate patients and public about ovarian cancer. What's new in ovarian cancer, what to know, what you need to know as a patient or someone who's related to a patient or even in the general public of women. It's the most leading cause of death in women among gynecological cancers, which include uterine, cervical, and other gynecological cancers. So it has an impact in the mortality in women from cancer. So we just want the public to be aware of what's out there and what are the advances that we have in treating and even diagnosing ovarian cancer.
Ovarian cancer is not a very common cancer, but it is a significant cause of mortality in females. It's a very difficult cancer to diagnose, and when you diagnose it, most of the time, it's at a late stage. Us focusing on ovarian cancer is to raise awareness of this disease, so that if people develop these non-specific symptoms, that they would seek further medical attention to try and diagnose the cancer at an early stage, because the survival is clearly dependent upon discovering it at an early stage with better outcomes then.
There is no standard test for screening. There are certain tests that may be helpful. Most of those tests are in patients who are high risk or patients who already have history of ovarian cancer to make sure they don't have recurrence. There are a lot of studies to look for one, but there is no test.
Mostly women in their post-menopausal, but you do have an earlier incidence in familial ovarian cancer. There's a subset of patients who have what is called Lynch syndrome, and they have a specific genetic mutation, and 13 to 15% of patients with this particular mutation will develop ovarian cancer, and they will develop it at a young age. Similarly, people who carry the BRCA1 and 2 gene, they have a risk of developing ovarian cancer. In BRCA1 carriers, the risk is 35 to 45%. In BRCA2 carriers, the risk is about 15 to 25%.
I just want to emphasize the importance of education and awareness among people and encourage people to always ask questions, because patients should be involved in their care and they should try to know about their disease and treatment, even if they feel it's complicated.
You'll find contact information for all the services offered at Florida Hospital Waterman's Cancer Institute when you click the Women's Cancer Story Link icon on our homepage at yourhometownhealth.com.